Hi guys, if you want to turn to page 18 of your training manual now, we're going to talk about the guidelines to designing the perfect exercise program. As you'd have read in your manual and as Ross would have discussed in the earlier videos, we'd have talked about the biological changes, the emotional changes, the postural changes, and while it's great to all have that knowledge, now we're going to look to applying that knowledge to kind of making the best programs you can do, making sure you're creating safe and effective programs for your client and your client's baby. What we're looking at to begin with is you want to make sure that whilst we're PTs and bigger focus of our business is on resistance-based training, you want to really talk your client into using all forms or all different modalities of fitness. So I love to kind of preach to my client to, yes, come see me 2-3 times a week, we'll work on strength and resistance, but you also really want to encourage them to do a session of stretching once a week, a session of meditation once a week, cardiovascular training. It's really important to kind of get the holistic well-being of your client. You really want to make sure they're doing a little bit of everything, and that way you know they're going to have a kind of safe and effective pregnancy. In terms of periodization, I'm sure most of you as trainers periodize, whether it's for a 5k run, a 10k run, or whether it's for weight loss. We like to look at periodization in 2 different formats. The first format is if you're coming, you've got a pregnant client, your first period is to get your client as fit and as strong come labour time as possible. So whether your client walks in through the door and she's 10 weeks pregnant, or whether you've been training her all the way through and she falls pregnant, your goal is pregnancy. So come labour time, you want her to be as strong, as fit as possible. The second period that we look towards is postnatally. We want our client to be as fit and as strong and as complete as they were before they felt pregnant. And a common mistake that we find most trainers make is they get fooled into thinking just getting the mum back to their pre-baby weight is their goal. Yes, that's a fantastic benefit, but realistically we're looking to not only get them back to their pre-baby weight, but we also want to kind of build them from inside out. We want to make sure their abdominal muscles are as strong as they were before pregnancy. We want to make sure their glutes are firing before they were pregnant. We want to make sure their pelvic floor is back to full functioning. Once all those things are ticked and they're back to their pre-baby weight, then you can say that period is over and you've completed your goal. Warm-ups and cool-downs should increase throughout pregnancy. As Roscoe would have discussed, extra blood in the system, body takes a little bit longer to warm up, same as it takes a little bit longer to dispense the heat. As a rule of thumb, this is just what we use. I like my clients to warm up and cool down for 4 minutes in the first trimester. I like them to warm up and cool down for around 5 minutes in the second trimester. And in the third trimester, you're looking around 6-minute warm up and a 6-minute cool down. As I said, this is just a rule of thumb, and you can choose to follow those guidelines if you want. Borg scale of the perceived exertion. As we'll discuss this one in a little bit more detail later, but that is the new scale of how hard you can work your client. Obviously, a big question a lot of your clients are going to ask you is, how hard can I be pushed, or how hard can I work? And yeah, we used heart rate monitors in the past, but now we're looking at what kind of gauging how hard your client works by how much they can talk during a conversation, how high they are grading their perceived exertion. So if they're thinking they're working at 10 out of 10, then obviously that's too hard. Wherever they're working at 2 out of 10, that's not enough. But we'll go into a little bit more detail about exactly where you want your client working in a little bit more detail later on. You want to avoid any overhead movements, as Roscoe would have said earlier and in your manual, and you also want to avoid the supine position, obviously the danger of the blood flow being cut off towards the uterus. And the final one on this slide is incorporate longer rest periods. Obviously, as later your client will go through pregnancy, she's going to need more rest, more recovery before she jumps into exercise. Again, this is just a rule of thumb that we like to use here at Limitless. First trimester, if they're fit and strong and you've been training them for a while, normally we'll look for around 60 seconds rest between each sets. Second trimester, you're looking around 75 seconds, and third trimester, you're looking at 90-second rest between each of your sets. This first point on this slide is focus on breathing. And I'm sure most of you as trainers have worked with your client on breathing and diaphragm breathing and just encourage them to breathe the whole way through your session. It becomes a little bit more important when your client is pregnant. main reason being, if your client is struggling to get enough breath on board and she's struggling to get enough oxygen on board, that doesn't only affect her, but it also affects the baby. So you as the trainer, you've got to be on top of this a little bit more than your normal client. You've really got to make sure that every time your client is working through a set or working on the cardio machine, you've really got to make sure that they're breathing the whole time. You really want to make sure they're not holding the breath. Personally, we take out any exercises where there's a risk of them holding the breath. So I would take out all kind of wall sits, for example. So generally when people hold their breath, or brace themselves in a wall sit, there is that tendency to hold their breath and brace themselves. So it's up to you guys to think of exercises where you think your client might hold your breath, but as the trainer, just encourage them, make sure they're breathing the whole way through, make sure there's no gaps in breath, make sure there's enough oxygen going to her and to her baby. Quality is always better than quantity. Sounds very obvious, but as you've seen the way the fitness industry is going, lots of people are kind of working to failure, working to ANRAPs, and that's not what our goal is today. Generally, I would always give my client a rep range to work towards, and I would never give them a time-based workout towards. So the meaning behind that is you would never say to your client, do as many squats as you can in 60 seconds. To be honest, there's no real benefit to them rapping out 50 squats as quick as they can. They're going to get out of breath, their technique's going to become poor, they're more likely to get injured. Just give them a set rep range and they're going to have a lot more benefits from that type of workout. Intensity decreases throughout pregnancy. Again, this will sound pretty much like common sense. As they get bigger, as they get further along into their pregnancy, their work capacity is obviously going to drop. As a rule of thumb, if you've been training your client and they're fit and healthy going into pregnancy, I'd be quite happy to train my clients through kind of circuits or tri-sets, even giant sets, as long as I'm spreading out the rest periods appropriately. In the second trimester, I would ease them back down, and the most I would look to push my clients is probably a superset, just to make sure that you're not overloading them. And the same with the third trimester, I'd bring that down to single set activities. So I would give them an exercise followed by a rest, an exercise followed by a rest, just to make sure they're not overloading, they're not overworking, they're giving their body plenty of time to relax, recover, and move on to the next exercise. Avoid high impact or contact sport. I know it says exercise there, but really it should be contact sport. It's a contentious issue that a lot of clients kind of might raise with you guys, and personally I've had many questions asked about clients that wanted to continue to play football or rugby or horse ride. The truth is, if after 12 weeks when the baby kind of raises out of the cervix, it's no longer protected, and the risk of trauma then leads to the chance of the baby being lost. So if they have been playing sport their whole life and they think they're really good at it, but it only takes one nasty fall or one nasty kick or one nasty knock, and there's a chance of them losing the baby. So I'd always generally try and encourage my client to just say, take 6 months off, take 8 months off, just don't worry about your sport, just concentrate on the gym, concentrate on the other things, and then once you've had the baby, you'll be safe, and then get back to your sport at a later date. It's not always the easiest conversation to have with your clients. I know a lot of people love their sport, but if you just highlight the risks and the chances that they might lose their baby from their sport, most clients are willing to listen, and they'll come around to your way of thinking. Roscoe would have mentioned this, but yeah, you want to discourage exercise in hot weather. Obviously, you don't want them overheating, so you want to keep their systems as cool as possible. And the same flip side of that is you want to promote as much hydration as possible. Water is obviously going to become more and more important throughout pregnancy. As the mother grows, she's going to want more water. As you're making her exercise, she's going to need more water. So just make sure, never train your client without a water bottle near her or next to a bubbler. You've just always got to encourage her when she's in the rest period, just to make sure she stays hydrated the whole time. Again, Ross would have mentioned this, and it's in your manual, but you really want to take out all forms of crunch exercises after 16 weeks. The main reason being is the abdominals aren't going to be working the way they should post 16 weeks. They've become misshapen, misaligned, and their function isn't going to perform the crunch. And you're more likely going to injure that muscle group and injure your client if you continue to do crunches. Also, the chances if they have diastasis, if you do that crunch-based movement, that diastasis is going to come even worse. So you really want to take that out of all your programs. Personally, I would take it out before week 16, but as a guideline, they say definitely take it out at 16 weeks or over. Interval training. Obviously, most of you PTs will be using interval training for fat loss or for real conditioning. Neither of these goals are particularly what you want during pregnancy. Yeah, you want your client to be fit, but you don't want those big peaks and troughs in their heart rate. You're not looking to create epoch. You're just looking for your client's heart rate to kind of stay nice and steady, not peak too high, and interval training is just going to stress their system out too much. So you really want to avoid interval training just to make sure their heart rate's not overloaded and overstressed. I'm sure most of you trainers will be doing this anyway. It's a course of what most trainers or most good trainers should be doing, but you really want to find out as much information about what's going on with your client as possible. So just make sure you're asking lots and lots of questions. At the beginning of a session, just make sure your client's eaten enough food, she's drunk enough water, she's had enough sleep. Make sure she's not only in the right physical, but also in the right emotional state to go through this session. Yes, you might have wrote this awesome program, but if she's not ready to go through that, then there's more of a chance that you're going to injure your client or overstress her or overload her. So just make sure that you're aware of how she's feeling, how she is, before you take her through that session. Roscoe went through, and this on the manual, of the importance of questionnaires. Again, with these bullet points, you're just making sure that you're covering yourself. The more questions you use on the questionnaire, the more information you have on your client, the more it covers you as the trainer, and the kind of better information you can have to create the best programs. You can find out what training they've been doing, if they've had babies in the past, if they're what week they are, what due date they are. The more information you can get from the questionnaires not only covers you, but it also builds a better product for you to give to your client. Whilst we are personal trainers and we specialise on exercise, you really want to encourage, it's a lifestyle. They're having a healthy pregnancy doesn't mean they come to the gym 6 times a week, but then they go and leave and have 3 hours of sleep a night and they're smashing Mackie D's. You really want to make sure that they are training, they're eating right, they're sleeping right, and they're de-stressed as much as possible. Whilst us as trainers, all we can do is kind of really concentrate on the exercise side of things, it's nice just to kind of highlight the importance of these other factors to your client to make sure they're getting the most out of their pregnancy. Personally, I like my clients to train 5 times a week. Again, this is up to you as the trainer to decide whether your client can fit that in or that they can't, or if they're really fit they might want to train more. If they can't fit it in, they'll only train twice. But as a rule of thumb, we like to kind of preach, if they're doing 5 times exercise a week, then you're pretty much guaranteeing you're hitting all those different modalities. You've got strength work in there, you've got cardiovascular work in there, you've got meditation and stretching in there. So 5 times a week of mixed training will be a fantastic result for your client. And here's the dangerous one. The reason we put this one in the bottom is try not get into the habit of thinking that one client or one program fits all. Don't think that you've got this fantastic second trimester program and then you have 2 second trimester clients, one after the other, and you think, bang, bang, I can just use the same program for them both. It's a lot. Yes, by all means have templates for each trimester, but you've got to be aware that every client is different. Pregnancy will create enough problems in posture and pain and aches and illnesses that you will have to constantly reevaluate your programs every week. You constantly have to change things, tweak things. Just be aware that having a plan B exercise is a great way to making sure that your client will have a great workout. You might have a great program set up and your client walks through the door, but she's had 4 hours sleep and she hasn't eaten and she's got slight lower back pain. You cannot take her through that program that you have planned, so just have a kind of a plan B always in place. Just finishing off on those 20 guidelines, here is an exercise frequency graph that if you can see in your manuals and you can see it on your slides, this I like to print off one of these and give it to all my new clients, and it gives the client an idea of exactly how hard I want them to, kind of what they're looking for, what their goals are. I think if people visualize something, they're more likely to achieve it. So whilst it's great to say, look, train 5 times a week, that might work, and it will work for some people, but if you can tell them that and then show them that, the chance of them to do it is going to be reinforced. The things that you like to highlight from here is getting your clients into the habit of doing their Kegels 4 times a day. Breakfasts, like brushing their teeth, traffic lights, any habit that they can create, fantastic, the better their pelvic floor will become because of them. And then you're going to introduce calf raises in the 3rd trimester to create that blood flow, as Ross would have mentioned in the previous videos. And finally, how we've mixed up a combination of rest days, strength days. So we've got the 3 strength programs, you've got your cardiovascular programs, you've got your yoga, your meditation, and it's just a great template. By all means, you can use this one or create your own template, but it's just a good tip for any trainer to try and encourage your client to do what that you want them to do by just showing them exactly how you want them to act.